Do you sometimes notice that you have blurry or cloudy vision despite wearing proper eyeglasses? Or do you have trouble seeing properly at night and are a bit more sensitive to light? Well, you may be starting to develop cataracts. Have no fear though, cataracts are pretty common and what's most important, they are treatable. On the program today, we'll talk about what causes this condition and ways to prevent as well as treat them. I'm Dr. Freddy Gomez and welcome to MedTalk Health Talk on CNN Philippines. When the lens in your eye, which is normally clear, starts to become foggy or cloudy, a cataract may be developing. Our guests are here today to tell us more about this condition. With us is Dr. Arnold Salud. He's an ophthalmologist and vitreoretina specialist from the Medical City and American Eye Center. Also with us is Dr. Edward Uy. He's an ophthalmologist and a cornea and external disease specialist from the Makati Medical Center. Thank you both for joining us on the show. Now, many people may develop cataracts over their lifetime. I'll start with Dr. Arnold. Common ba ang cataracts dito sa Pilipinas, Dr. Arnold?
There are several other causes, but the main cause is aging. So if we will take into consideration aging, it must be just about the same with any other country. But because there are other things that can cause early cataract formation like diabetes, steroid use for other illnesses, trauma, because we have a very high case of diabetes here in the country, our incidence of cataract is much higher compared to others.
We'll talk more about some of the risk factors later on the show. And speaking of aging, more than 50% of people actually over the age of 50 is common to have developed cataracts. Now, most people start getting it around the age of 40, according to some of the statistics, but they don't really notice symptoms until after the age of 60. Now, the condition is a real concern for all of us as we get older. But there are some factors that can make you more likely to develop it. Now, Dr. Dado, who are more prone to having cataracts?
So first and foremost, the elderly population are at risk. So anyone 60 and up have a higher likelihood of developing a cataract. People who are medically not normal in the sense that they have a medical illness will be also more prone to get it earlier.
Now, Dr. Dado, we all know that smoking is linked to a lot of diseases, heart disease, lung disease, but some of the studies also show that it's also linked to some eye problems as well, including cataracts. Could you explain this a little bit for us?
So smoking affects the body in a way where no one really realizes how severe it can be. So if it affects the eye, usually cataract is one, macular degeneration is another.
Now, in fact, the United States Food and Drug Administration reported that people who smoke are 2 to 3 times more likely to develop cataracts. So quitting smoking cigarettes can significantly reduce your chances of developing it. Now, most cataracts are related to aging, as what was mentioned by our guests, but there are also some types that can develop during childhood or due to other health problems. Dr. Arnold, who else can be affected by cataracts? And how often does it occur in people below the age of 40?
When you're young, there's also what we call congenital cataract. So you can be born with it. And as mentioned, people might not notice that they are starting to have cataract, but that's the importance of seeing your doctor, especially if you have other illnesses in your body.
Dr. Arnold, let's touch on the trauma part a little bit that causes cataracts. Can something like corneal abrasions, like wearing contact lenses for long periods of time, can this be classified as a trauma that can lead to a cataract in the future?
Strictly speaking, no, because with corneal abrasion, you just touch the front part of your eye. Again, I always try to compare the eye with a camera. The cornea is the cover of the lens. So if you scratch it, there's no effect on the lens itself.
So whether it's because of aging or injury due to trauma, many will experience a cataract at some point at a certain age. And it's vital to understand its symptoms so that you can get proper treatment right away. When we return, we'll discuss the signs to watch out for. We're your partner in health, so keep it here on MedTalk Health Talk, only on CNN Philippines.
SMC, San Miguel Corporation. Bisag unsang industriya ang sudlan niini, tinguha sa SMC ang pag-uswag o paglambo sa mga Pilipino. Karon, gikan sa SMC, aniya na ang SMC Davao Cement. SMC Davao Cement. Gama sa Davao, para sa Mindanao. SMC Davao Cement. Ato ni Bay.
Ito ang RBN, Radio Philippines Network, DXKT 1071 sa inyong mga radyo, ang Radyo Ronda sa Davao.
I'm Dr. Freddy Gomez and welcome back to MedTalk Health Talk on CNN Philippines. More than 50% of people over the age of 80 may develop a cataract, and they occasionally occur in young people as well, but not that often. So it's when the lens of the eye becomes foggy or cloudy, which can lead to blurry vision or vision loss if it prolongs any further. Now, Dr. Dado, let's talk about what to expect at first when someone develops or starting to develop a cataract. Ano yung mga unang simptomas na mararamdaman ng isang tao?
Yeah, for people who don't wear glasses, they automatically will complain of their vision getting cloudy. For people with glasses, they will often feel that they need to change their glasses even if they just replace their lenses recently. So your vision getting blurry, or if your glasses like getting foggy, that's the presentation of a patient with a cataract.
Dr. Dado, both eyes ba are affected at the same time when it comes to cataract, or is one eye usually affected first?
Usually, it's one eye affected first, but eventually the other eye will get the same symptom.
Now, eventually, the area of blurred vision is likely to grow as your lens becomes more and more cloudy. Now, Dr. Arnold, tell us more about the progression of the symptoms. What is the time frame before we feel slight symptoms to a person's vision loss is already apparent?
We always describe to our patients that having cataract, we will have cloudy vision. And a lot of them find it hard in the beginning to accept that it's the cloudy vision that's disturbing them. Later on, it gets worse, like looking through a frosted glass. And that's quite late already.
The reason why I asked that, Dr. Arnold, because I think ugali sa mga Pilipino is titiisin hanggang kaya. So what is the best time? Is earlier better than later in this case when it comes to cataracts?
Well, to me, two things. We always discuss levels of cataract, but there's some form of subjectivity to it. No, An early cataract for one person may not be that early for another person. So at the end of the day, I think it all depends on the person himself or herself. No, if he or she feels that the quality of life has changed, then the cataract has to go. And the only way you'll find out really is if you visit your doctor.
Yes, that's true. To emphasize to our viewers, if you notice anything that changes and affects your quality of life, always have yourself checked. Dr. Dado, we talked a little about some of the risk factors, but let's go through some of the causes of cataracts. What was mentioned, of course, is diabetes, and having it can make you more vulnerable to cataracts. Tell us more about this, Dr. Dado. Is this a case of all diabetics, or are there certain parameters which may prompt someone who is suffering diabetes to develop cataracts?
It's more of those people who are undiagnosed diabetes, people who are diabetic, diagnosed but with poor control. The longer you're diagnosed with the disease, the higher the chance for you to develop a cataract. So diabetes in essence doesn't only affect the lens, it can also affect the retina. So some people would feel that their vision is changing, but in reality, sometimes it's not purely a cataract, but retinal disease. So they need to see their doctor for that.
With the case of cataracts, will someone feel any pain while a cataract is developing? Let's talk about that.
Basically, initially, probably just the glare, the light, darkening of their normal vision, eventually blurring, but cataract don't usually cause pain unless it's a very mature or hyper-mature cataract in elderly people and the angle of the eye closes and develops a glaucoma.
So that is true. So that is why if you have cataract symptoms, pain may not always be there, but please consult your doctor right away. Now, Dr. Arnold, Walk us through how someone is properly diagnosed to have a cataract.
You can diagnose it two ways, by talking to your patient. And the best way really to diagnose it is the instruments that we use in our clinic. We have very specific instruments that can visualize the lens of the eye. And just looking at the lens, we can tell you if it has become cloudy already.
Now, Dr. Arnold, can cataracts be properly diagnosed kapag pumunta sa mall, dun sa paggawaan ng mga eyeglasses, or where do you recommend a person be properly diagnosed when it comes to cataracts?
Our partners are optometrists who handle the optical shops that you find in the mall. Okay, we would usually go there if we think that the eyeglasses that we wear are not functioning the way we want them to be. So it's either your grade has changed because you're growing older and your grade can actually change, or your vision is deteriorating because your lens is starting to become cloudy. So if that is the case, when your optometrist tries to get your grade via refraction, they'll find it hard. So eventually they'll direct you to the friendly ophthalmologist as well.
Now, cataracts can and will worsen over time, so your doctor will most likely recommend surgery for the treatment. More on this when we return. Your health is our mission here on MedTalk Health Talk. You're watching CNN Philippines.
SMC, San Miguel Corporation. Bisag unsang industriya ang sudlan niini, tinguha sa SMC ang pag-uswag o paglambo sa mga Pilipino. Karon, gikan sa SMC, aniya na ang SMC Davao Cement. SMC Davao Cement, gama sa Davao para sa Mindanao. SMC Davao Cement, ato ni Bay.
Ito ang RBN, Radio Philippines Network, DXKT 1071 sa inyong mga radyo, ang Radyo Ronda sa Davao.
I'm Dr. Freddy Gomez, and this is MedTalk Health Talk on CNN Philippines. Blurry vision is a telltale sign that a cataract might be developing. Now, while this can be mild and manageable, they tend to grow progressively worse, and they eventually interfere with daily activities like reading and driving and your overall quality of life. Now, Dr. Dado, earlier on the show, we talked about how cataracts are diagnosed. Now, let's talk about the treatment this time. A lot of our viewers, when they hear surgery, they always have some form of anxiety. So they always ask, pwede bang idaan sa gamot ang cataracts, Dr. Dado?
Not all cataracts needs a surgery right away. So for people who can still wait, or they decide to wait and just be corrected with spectacles, that's their decision. But it's more of the patient being given the proper information for them to undergo the procedure safely.
Okay, so Dr. Dado, what you're saying is surgery is the best option when it comes to cataracts, but during the initial stages of an early cataract, yung medyo blurry pa lang ang vision, surgery can be held further down if corrective lenses can still compensate for that blurriness. Is this also applicable for those, like what we talked about earlier, those who are younger than 40, those who have probably a genetic predisposition to cataracts? Does the treatment follow the same for them as well, Dr. Dado?
So for people with a genetic problem like developmental cataract, they usually get blurred vision slowly. So it's a slow progression to the eventual surgery. So if the patient can still wait, then we usually advise them to just be more worried about the symptoms of the glare to light and all that. But eventually, if the vision can't be fully corrected or helped with spectacles, then we advise surgery.
Now, Dr. Arnold, pag-usapan natin yung surgery mismo. Ang number one tanong dyan, masakit ba ito, Dr. Arnold?
Again, for our audience, there are several kinds of surgeries for your cataract, no? Yung naririnig po ng mga pasyente natin, it's not that painful, but compared to the newer technology is quite painless. May kanya-kanyang lamang po yan, but the common denominator would be it's not as painful as our patients imagine them.
Dr. Arnold, will those undergoing cataract surgery be able to see a drastic difference in the quality of life, in the level of vision that they can get back?
Definitely. There's an element of magic in it, in the sense that people come in with very cloudy, poor vision. They go home close to the vision that they will get in the next few days. They can see the difference already even prior to going home.
So cataract surgery now is much different than it was years before. Yan ang sinasabi ng mga guests natin. So the comfort level is much improved, as well as the level of improvement that you will get with your eyes. Now, Dr. Dado, pag-usapan naman natin ang recovery dito. What is the downtime for someone who has undergone cataract surgery?
People who undergo surgery, since it's topical anesthesia, they can usually see right away. So it's not something that you have to stay in the room for, they can't go out and all that. They just need to wear some protective goggles during the day to protect them from any possible trauma to the eye. And they usually see immediately well the next day. Usually the healing period is about a week or two, and then full healing in 6 weeks.
How long can that person go about by their daily activities, Dr. Dado?
For people with no strenuous activities, they can usually go to the office immediately the next day, although we still advise them to be really careful with regards to things that they read, and if they need to carry something to the office because of possible trauma and something hitting their eye. But they can eventually start their normal activities the next day.
And Dr. Arnold, for someone who has gone through cataract surgery, should they be worried about the cataract recurring?
Cataract doesn't come back. Okay, so it's a one-time thing. Once removed, it doesn't come back. That question probably emanates from some patient experiencing that they get the blurry vision again months or years after cataract surgery. Basically, the lens that we place remains clear for the rest of their lives. There's something that happens on the bag, the thing that holds it, that makes it a little bit cloudy again, but gets fixed in a few seconds, that we laser eventually later on after surgery.
And Dr. Edward, we've explained thoroughly how the main risk factor of having cataracts is aging, but a lot of people may be wondering, meron bang kinakain ng isang tao that may lead them more prone to having cataracts? Does diet have a role in cataract formation?
With regards to food, probably not. But some people take something like a steroid to help them build up their muscles. Those medications like steroid can produce cataract early in a person's life. So we just need to be careful with regards to medications or anything that we take in, because sometimes we don't know the ill effects of what we take.
Now, before we go, I'd like to get some parting messages from the two of you. I'll start first with Dr. Arnold. Do you have any message for our viewers?
Cataract is inevitable because it's mainly because of aging. There are many other causes of cataract, specifically diabetes. So, bottom line, take care of your health. Accept the fact that aging will cause cataract. Take care of your health so you don't develop it sooner than expected.
Very good. And of course, Dr. Dado, any parting message for our viewers?
Dr. Arnold and myself are here to help you. So doctors are not here to for you to be afraid of. So just a reminder for you to see your doctor so that we can help you with cataract if ever you have one, for better vision and better quality of life.
And we definitely know more about cataracts today with this episode, thanks to the two of you. So thank you very much, Dr. Arnold Salud and Dr. Edward Uy, for being with us today and sharing your information with all of us. I'm Dr. Freddy Gomez, and thank you for watching Net Talk Health Talk. We'll see you again next time.